Okay, so we're going live in 1 minute. Okay.
Good morning, everybody, and welcome to the Health and Wellbeing Board here on Tuesday, the 23rd of June, 2020. This is a virtual meeting by Zoom. I'd like to welcome all councillors, officers and members of the public viewing on YouTube to this first virtual meeting of the Health and Wellbeing Board. My name is Councillor Rob Appleyard and I am co-chair of the board. I will now call out the names of the other members of the board and ask them to confirm that they are present. Bryn Bird, the CCG.
Yes, hello, Rob. Good morning, Rob.
Thank you, Bryn. And for information, Bryn is the co-chair of the board. Corinna Edwards, CCG.
Yes, Rob, I'm here. Thank you.
Thank you. Sarah Gallagher, Bath University, Bath Spa University.
Morning. Yes, I'm here.
Thank you. Councillor Kevin Guy. Are you with us, Kevin? Okay, I saw him earlier. He might have lost connection. Will Godfrey of Baines, Chief Executive.
I'm here, Chair.
Thank you. Paul Harris, Director of Curo. Okay, no Paul at the moment. Les Hutchinson at Baines.
Hi, yes, I'm here.
Thank you, Les. Steve Kendall, please.
Present, Chair.
Thank you. Bruce Lawrence, Director of Public Health.
Yes, I'm here, Chair.
Thank you, Bruce. Kirsty Matthews, I think Kirsty is being substituted by Joe, and Joe's arriving a little later, I understand.
Yes, Joe is here. Yeah.
Okay, thank you very much. Stuart Matthews, Fire and Police, no. Fire and Rescue, sorry.
That's okay. Morning, Rob. Thank you. Yes,
morning.
Yeah, present.
Morning. So your description was on 2 lines. Bernie Morley, University of Bath.
Yes, I'm here, Rob.
Morning, Bernie. Kate Morton, Bath Mind.
Yep, I'm here.
Thank you. Laurel Penrose, Bath College. No, okay. Vanessa Scott at Health Watch, new Chief Executive.
Yeah. Yes, I'm here.
And welcome. Andrew Smith at Primary Care.
Hi, Rob. Yes, Rob. Hello.
Okay, and Libby Waters of the RUH.
Good morning. Yes, I'm here.
Okay, thank you very much. I understand we have an observer, Councillor Robin Moss. Welcome, Robin. And
Hi, good morning. Hi, Rob.
Particular welcome to obviously to Bryn, Vanessa and Libby, as this is their first Health and Wellbeing Board. So thank you very much. This meeting is being held under the Local Authorities and Police and Crime Panels Coronavirus Regulations 2020. The Council has agreed protocol to cover virtual meetings, and this meeting will operate in line with that protocol. The meeting has the same status and validity as a meeting held in the Guildhall. Can I remind everyone to keep the background noise to a minimum, to only speak one person at a time and not speak over others. Please mute your microphone when not speaking and then unmute and I will invite you to speak. Please indicate if you wish to speak by using the chat facility on Zoom by typing MIS, may I speak, and I will call you to speak in turn. Does anybody have any questions to that? No, okay, fine. Well, obviously I will try and catch everybody as we go through. It's not an exact science, but we'll obviously do it the best way. First of all, apologies for absence and substitutions. Can I ask Marie if there are any apologies? Substitutions?
Yes, have apologies from Mike Bowden from Baines, Nicola Hazel from AWP, and Laurel Penrose from Bath College. And I think, as you said, Kirsty Matthews is a centre substitute member as well.
Thank you very much, Marie. Okay. Declarations of interest. Can I ask for any disclosable interest together with the nature of such interest to be declared? No. If anything becomes apparent during the course of the meeting on a particular item, can you then make it known, and we will then record it, and obviously the appropriate action will be taken. The next item is to announce any urgent business agreed by the chair. There is no urgent business that's been reported in. So I will now move to public questions and comments. And I understand we have some late questions coming, did we, Marie?
Yes, we've had 2 questions. Did you want me to read them out?
Yes, please.
Okay, so the first question is from Margaret Preddy. In light of the current pandemic, slow release of lockdown measures, social distancing recommendations, increasing numbers of day visitors, and the closure of many toilet facilities within shops and cafes, what proactive steps are being taken to ensure that additional toilets with hand sanitation and/or washing facilities are provided in the UNESCO World Heritage Site, that is the city centre of Bath, in order to reduce transmission of COVID-19? The precedent has already been established for additional toilet facilities to be brought in during the annual Christmas market. And the second question is from Debbie Clifton. I agree with most of the COVID-19 outbreak management plan, but what about testing availability for Black and the minority ethnic groups, as it has been proved that this group are a high risk for COVID-19? What plans are going to be in place for the winter months? How is the medical profession going to sort out between COVID-19, flu and pneumonia? As giving the wrong advice will probably lead to deaths, as medical intervention is needed early, especially with pneumonia. As far as I am concerned, there is no reason why the people in care homes, etc., should be denied healthcare, as it has been proved that old people can survive this with medical treatment. Your statement gives me the impression that they will be denied medical treatment if it is needed.
Okay, thank you very much. These questions came in quite late to us, and we haven't been able to formalise a proper and thought out response to those. And so we will respond within 5 working days to those questions, and the answers will be included as a post to the minutes of this meeting. The next item is minutes of the previous meeting held on the 21st of January. You should have all seen these, and I'm just looking for just a hand to indicate that everybody accept these. Can I please see a show? Thank you, thank you, thank you. Thank you, thank you. Yep, okay, thank you. And these will be signed obviously at a later date when we join up. The next item is actually the update from the Children and Young People subgroup. And I believe this is Leslie and Sarah McCluskey, correct?
That's correct.
Okay, thank you.
So I'd just like to introduce myself again. So I'm Leslie Hutchinson, Director of Adult Social Care Complex and Specialist Commissioning. Because of my responsibility around children's commissioning across both the council, but also partly across the clinical commissioning group, I chair the Children and Young People's Subcommittee. That is a subgroup reporting into the Health and Wellbeing Board. We have a Children and Young People's Plan, and you'll see that within this document, we have submitted the plan on the page. The plan is from the strategy and the plan are for 2018 to 2021. And it sets out what the vision is, what the 4 outcomes for children are, and what our 11 priority areas are. Sarah McCluskey, who's going to present the main document, is the Strategic Commissioning Officer, and I'll welcome Sarah in a minute. But you'll see that there's quite a substantial piece of work being undertaken for year 2, which is the report that we're sharing with you today. There are a number of questions that it's asking of the Health and Wellbeing Board, but I'm conscious
that we won't be able to get a response to all of those. It is more for a request for the Health and Wellbeing Board to take on board some of those actions that we need. But this is to show you and demonstrate Year 2 report and the outturn for what the Children and Young People Subcommittee have been doing in response to the outcomes and the priority areas. What we have tried to do in response to Will Godfrey's request at the last meeting, which was to make sure we tried to indicate as much as possible trends, relative performance, and try to demonstrate the outcomes. We've tried to make a concerted effort in this report, which is quite different in terms of some of the data that's being presented as well for the Year 1 report, which is an attachment. We've tried to be more detailed in some of that to try to respond more clearly to that request. However, this is a work in progress, and we will be certainly, when it comes to the end of the Year 3 report, we will be making more detailed in relation to those particular areas that were highlighted as a need. And I'd just like to say that also at the end of this, we're in the middle of developing the strategy that we will be taking forward and bringing to you, which will go from 21 to 24. I'm assuming it will be another 3-year strategy, but we need that to, of course, align to the health and wellbeing strategy that will be developed as well. So I just wanted to make reference to that. So any comments and feedback that you bring in, we will take that to the development for our new strategy going forward as well. So can I just hand on to Sarah McCluskey now, who will be able to take you through the body of the report, the Year 2 reports, but I am conscious, as I say, of the length of this report, and Sarah will do her best to pick out the highlights which she thinks are most relevant to be discussed. Over to you, Sarah.
Thank you. I'd firstly like to reflect to the board that the Year 2 review has been collated over the last 2 months at a time when colleagues have been incredibly busy reorganising the service delivery in light of COVID. So thank you to everyone that produced a report for the progress report. I think, as Leslie said, it's a big report to read. And I think what would be useful from the board is to get feedback and observation about whether or not the template itself is in a helpful format for the board. Is there anything that's missing from the report that the board would like to see reflected in our Year 3 report going forward? Because we're doing some planning around the way we'll report for Year 3, particularly in light of our priorities and as a reflection of COVID going forward, as things will have to change and be delivered slightly differently. So I'd just like to request that if any member has anything that they want to bring forward as an observation about the reports, then we'd be happy to hear that from them.
Okay, just see if there's anybody indicating to speak. No, nobody has indicated they wish to speak or any questions on the report. I know Councillor Kevin Guy is having trouble with connection, so he will be in and out of this one. So I can't obviously rely on him having a contribution on this. Is there anything that you want to specifically bring out on this one, Sarah?
No, I would just hope that everyone's had a chance to read the report, and particularly around some of the challenges, which obviously in light of where we are at the moment, that's been quite difficult to tease out for everybody. But yes, I think it's Kate want to come in?
Yeah, thanks, Sarah. Kate? I may have missed it in the report. Has the financial envelope shifted in terms of the challenges that's coming through? Have I missed that?
The financial envelope for the Year 2 report didn't move at all.
Okay.
And we've just reported on what the activity has been during Year 2, because it's an end of year return. There may be changes to the Year 3. But we have tried to make sure that's got to go through a proper process.
Okay.
So that's not indicated in here, because at the time of writing this,
it
wasn't the situation wasn't the same.
Yeah, I assumed. Lovely, thank you.
Okay, I have two speakers, Paul from Curo and Councillor Kevin Guy. Are you with us, Paul? Or have you lost connection again? No, okay, we'll come back to Paul, and if we can pick up with Kevin, please.
Thanks, Chair. Yes, sorry about my internet problems. I'd just like to thank all the staff on behalf of the board. Really, they've worked in extremely difficult circumstances under the recent months, and they've obviously put together a very comprehensive report to us. So on behalf of the board, I'd just officially like to thank all their hard work. I'd like Leslie and Sarah to pass that on to all their members of staff on our behalf. Thank you very much, Chair.
Thank you. I've had a message from Paul. Unfortunately, his sound doesn't seem to be working. And I'll just throw it out there, Paul, is that still the case? Yeah. Well, he posted a question here. Was going to suggest that it might help to understand how well the strategy has been delivered if there were high levels RAG metrics to summarise. So I think that was a suggestion there, Sarah. Did you pick that up?
Yes, I did. We have in previous reporting over the years that we've been putting together these reports on the delivery of the plan, used different RAG rating systems previously. So we'll take that forward as a discussion for the next CYP subgroup.
Okay, and thank you. And I think Bryn wishes to come in.
Yeah, thank you, Rob. I haven't got as much to say on the structure of the paper but being new to this and reading this for the first time, I was really enthused to see some of the work that's taken place that I wasn't aware of as much as 3 months ago. And I think many of the group know sort of the effect of adverse childhood experiences on children in their adult life, and seeing the work that's taking place to mitigate this is very encouraging. And we do a lot of, well, we're going to do more work on health inequalities in adults, but actually we know that's a lot harder than managing when they're children. So I just wanted to comment that in the healthcare side of Baines, we probably have quite a duty and responsibility to take this piece of work very seriously and enable it as much as possible. So I'd just like to pledge some support to that over the coming years.
Okay, I'm not seeing any other requests to speak. No, okay. So
could I just ask then? Sorry to interrupt.
Yes, Leslie.
Could I just ask, because I think we've got this development session for the Children and Young People subcommittee that's coming up, and as Sarah's indicated, we want to think about changing the reporting template so that it's more accessible than the way that it is just a narrative piece, to try and change the structure of that a bit. We will include, I think it's a good idea to go back to including the bit on the RAG rating. I think that will help. But if anybody does have a particular focus that they would, anything that they particularly like us to focus on in more detail, then it would be really helpful to know that. I mean, I think what we will do for year 3 is do a particular focus. We'll do a pull out, if you like, in terms of children's mental health, because we are conscious of the impacts of COVID and the rising potential for the rising number in that. So we will make a concerted effort on that. But also there's some public health bits that we need to focus on as well. So I just wanted to add that, really. We are going to think about the structure of this so it isn't so narrative based, to try and digest it a bit more easily, as well as demonstrating how far we've travelled in terms of the outcomes that we were set to achieve. But please do come back to us if there's anything else you'd like to look at.
Okay, I think Will, you wish to pick something up?
Yeah, sorry, thanks, Rob. Just to reflect on it. So, I think putting the trend data in, as we talked about last time, is really helpful. I think there's still a lot of information in there,
which is really helpful. But I'm just wondering whether or not, maybe in terms of accessibility, we could just like have a bit of a headline, sort of, you know, something at the beginning of the report that just actually pulled out some of those key things, so that people don't necessarily have to read the whole document. I think that might be helpful for people, just, you know, particularly members of the public reading it, just to give them a sense of exactly what the key issues are.
Well, similar to like an executive summary.
Yeah, just something in the beginning that just sort of, you know, just gives a couple of key metrics that just demonstrates our performance, etc. It might just be more helpful for people, I think.
Okay. Yeah. Okay. Thank you. I don't think, I'm just going to double check. I've got no other indicators to speak. So what I will ask the board to do is to agree the recommendations. And in terms of voting for this, we're going to follow the same principle that we do on other meetings. We're going to take it that you accept the recommendations unless you either vote against on chat or abstain. So those that wish to do that, either vote against or abstain, can they please indicate on the chat, please? Okay, I'm not seeing anything coming up on chat. I'm not aware of anybody having any difficulties, so I will take that is actually a unanimous acceptance of the recommendations. And can I say thank you very much, Sarah, for your stewardship on this one. It's a complex piece of work. It's a very important piece of work, and thank you very much for bringing it to the board. So thank you. Okay. Move to the next item. I think it's the autism strategy update, and this is again for the board to note its progress. And I'm going to invite Rebecca Potter. Hello, Rebecca, to present the piece. I can't see you on my. Oh yes, I can. Hello, Rebecca.
Hi, Rob. Hello.
Hi.
Yes. Hi. Yeah, my name is Rebecca Potter. I'm one of the commissioning managers in the specialist commissioning team at the council, and I chair the Autism Partnership Group, and I'm leading on the development of the all-age autism strategy. It's quite a long presentation. If I'm going into too much detail, please do let me know. And I'm hoping that Susan Hayter is going to be able to share my slides for me, because I've had a few technical issues. That's brilliant. Thank you, Susan. So if we can move on to slide, slide 2 would be great. Thank you. And so, yeah, just to highlight that this presentation will give a brief overview of the response of local services to the coronavirus pandemic and the plans that are in place for restart and recovery. It'll update the Health and Wellbeing Board on the membership and the work of the All Ages Autism Partnership Group, including the emerging all-age autism strategy. It'll reference the work planned across the BSW footprint, and the Health and Wellbeing Board is asked to comment and make recommendations for further development of the autism strategy and its implementation, including to consider the proposals for Baines and Partners to adopt the Ambassadors for Autism scheme, which is an initiative of the University of Bath's Centre for Applied Autism Research, which aims to make employers and services more inclusive and autism friendly. Next slide, please. So the autism strategy and associated work streams support the delivery of the Baines corporate strategy in that it looks to improve the support for families with complex needs, improve support for people with long-term conditions, promote mental health well-being and support recovery, improve skills and access to employment, and to take action on loneliness. Next slide, please. The active development of the autism strategy has been stalled since March 2020 due to the pandemic. Commissioners have been working closely with providers during this time to ensure that essential services continue to be delivered safely. Services have adapted well. We've seen very few COVID positive cases in local autism services and no confirmed COVID deaths to date. Supported living and residential services have continued to support autistic people in their homes. Some people have chosen to move back in with families at this time in the short term, but we're now seeing services plan for their return. Day and outreach services, including the BAS post-diagnostic support services and the Virgin Care Day services, Connections and Carswood, have had to work differently whilst following Public Health England infection control advice. Face-to-face support has been limited to those who have been unable to engage with support by phone and virtual groups. Day services are now working on their plans to reopen safely, and this will obviously involve smaller groups and social distancing. And obviously keeping up with all the changing advice has kept everybody on their toes. And actually I saw an update today to say that the Virgin Care Day services are expected to open at the beginning of July. So services have reported that phone and virtual support has worked really well for some autistic people, but others have found the change in routine very unsettling, and commissioners have approved requests for additional funding to prevent packages from breaking down and to keep people safe. Bathmind and Virgin Care have both reported an increase in levels of anxiety, complexity and mental ill health. And this has also been reported at a BSW level and nationally. And we're currently undertaking planning ready for an increase in demand for mental health services. Delivering diagnostic assessments remotely has proved challenging. The Children's Diagnostic Service has continued to gather information regarding autism developmental histories of young people on their waiting lists from families, carers, schools and other health and care professionals, and virtual team meetings with the community paediatricians have been held to discuss current cases and to coordinate service delivery. The service is now beginning to consider a recovery plan for when they're able to offer face-to-face appointments again. The BAS Adult Diagnostic Service closed its waiting list temporarily, but it's about to begin using the video conferencing platform Attend Anywhere to complete diagnoses. It does remain to be seen how well this is going to work, but we've heard from colleagues in Swindon that it is working well there. The specialist commissioning team is holding a provider forum tomorrow, and part of that agenda will be time to consider both the challenges and opportunities that have been presented by the current situation. So we aim to learn from that. Next slide, please. I won't go into detail regarding the legislation and statutory guidance that underpins the work of the Autism Partnership Group. However, in March 2019, the government launched a consultation as part of the comprehensive review of the National Autism Strategy. These findings have not yet been shared. We were expecting them at the end of last year, and they still haven't come out, and we're sure, it's been delayed obviously by the pandemic. But we are expecting when that guidance comes out that everybody will need to have an all-age strategy, and BAMES is already responding with the development of its all-age autism strategy. Next slide, please. It's worth highlighting the fact that the NHS long-term plan published in 2019 contains a commitment to do more across the NHS to ensure that all people with a learning disability or autism can live happier, healthier, longer lives. Specific objectives include the introduction of a digital flag for autism on the patient record by 2023-24 to ensure health staff know the person is autistic so that reasonable adjustments can be made. There are also plans to pilot the introduction of a specific health check for autistic people and to introduce mandatory training on learning disabilities and autism for all health and social care staff. Locally, BAS already delivers some of this training and consultancies to partners across health, social care, housing, criminal justice and education systems. The NHS long-term plan aims to reduce waiting times for diagnosis and to hold local authorities to account. Locally, pre-pandemic, we'd made progress around waiting times for adults' diagnoses with the successful use of a triage system that BAS introduced last year. And waiting times pre-pandemic were within the NICE guidelines of 3 months, and that's for the adult diagnostic assessments. The Transforming Care agenda continues nationally, and this aims to ensure that people with high and complex support needs do not get stuck in hospital, but are supported to move to local community-based support. Locally, we have a very small number of autistic people in hospital, and just discharge planning, including the design of bespoke services, is currently taking place. Nationally, the NHS long-term plan commits to halving inpatient provision for people with LD autism by 2023-24 compared to what it was in 2015. And we're working at a BSW level to plan and realise opportunities offered by at-scale commissioning. One example is a residential care project that BSW is organising, and that will include services for people with autism as well as people with a learning disability. Next slide, please. I can't see my slide, I'm assuming it's there. Can everybody else see it? No?
No, can't see the slides.
No.
I was hoping it would be slide 4. Sorry, slide 7. I don't know if Susan's still there.
Susan.
No. Do you want to talk through it?
I'll continue. Yeah. Okay. So, we last updated the Health and Wellbeing Board on our work on autism in January 2019, and at that meeting we flagged a number of areas for development, and I'd like to update you on those now. So the first area for improvement was around engagement, and we've done a lot of work since last year on that. Most notably, we've relaunched the Autism Partnership Group. This was re-established last year in July, and we've had 3 subsequent meetings and another one due next week on the 30th. It's an all-age board covering both autistic children and adults. These to date have been attended by a broad range of partners from across BAMES, including the universities, statutory and non-statutory health and social care providers, the police, a Department of Works and Pension, housing, education, and representatives from community and voluntary sector organisations, as well as a number of autistic people and carers and families. There's strong engagement in developing the new strategy and action plan, and it's gaining traction with the implementation of key priorities. I attached the terms of reference in Appendix 1 for your information. The APG co-produced its vision and values and identified the main priorities to be included in the strategy. If we had the slides, you'd be able to see the vision, but I'll read it for you anyway. It's that everyone with autism, whether living, working or visiting BAMES, will have the opportunity to choose the life they want to live. And BAMES will support this by building an inclusive community that understands. And the next slide, I wanted to go through our co-produced values and principles. You can't see them, so just bear with me whilst I find the slide and I can read those to you. Okay, so our vision, our values and principles. Autistic people will be involved at all stages of decision making about the things that affect them. People will be empowered to have a voice, giving them choice and control in all aspects of their lives. Guidance, information and support will be made available and accessible using a person-centered approach to make reasonable adjustments. And through working alongside and listening to those with autism and those who support them, will be flexible and responsive to changing needs, respecting people's individual views. And it's our ambition that autistic people can access what they need when they need it. They'll have access to an inclusive community, including health, social care and mental health services, education and training, employment, transport and housing. Okay, so as already mentioned, we've made progress regarding reducing waiting times for diagnostic assessments in the BAS adult service by introducing a screening clinic to triage assessments. And as I think I've already mentioned, pre-pandemic, we were meeting the NICE guidelines of a waiting time of no longer than 3 months. The Baines Paediatric Autism Spectrum Assessment Pathway is community paediatrician led, with some complex cases being assessed by CAMS. Pre-pandemic, initial appointments were offered within 8 weeks of receipt of referral, and waiting time for full assessments was typically 6 to 7 months, although usually less for preschool children. And these waiting times compare favourably with neighbouring local authorities across the southwest. I think obviously there's some work to do now to understand exactly what the impact has been of COVID on our waiting times for diagnosis, and we'll be doing that analysis shortly. We're reviewing diagnostic and post-diagnostic pathways at a BSW level as well, and we're paying particular attention to the arrangements in place for children and young people transitioning to adult services. We need to ensure that services are levelled up rather than down across BSW, especially as finances are so challenging. Waiting times in Baines are shorter than in Swindon and Wiltshire, and the BAS post-diagnostic support service is not currently replicated across Swindon and Wiltshire, and we're starting to have conversations about how we might be able to do that in the future. Engagement with partners and autistic people, their families and carers has improved, I would say, recently since we last reported to the board, but there is still work to do, definitely, to ensure that autistic people, families and carers are able to contribute in a meaningful way at a strategic level. In the children's world, SEND Partnership Board already includes family carer representatives, and children and young people and families were actively engaged in the review, redesign and recommission of the Autism Spectrum Disorder Outreach Service. This contract was very recently awarded to Fossway School, and the new service will start in September 2020. The 2019 report to the Health and Wellbeing Board acknowledged that there was more work to do to promote reasonable adjustments for autistic people across health and social care. And we commissioned BAS to deliver autism awareness training to partners. And this is a very good way of ensuring that partners understand how to make reasonable adjustments. And since last year, BAS has delivered this training to Job Centre Plus and the DWP, Police Custody, Bath University, AWP, CAMS, Bath Mind, Baines Council, Virgin Care, the American Museum and the IUH. And recently BSW put in a bid to NHS England for funding to deliver further autism training in key service areas. And we will be planning how to roll that out in the near future. The February Autism Board included a presentation by Dr. Jade Norris, who's at the University of Bath Centre for Applied Autism Research Centre. And she told us about the Ambassadors for Autism scheme. This scheme supports employers and service providers to pledge to become ambassadors for autism, making adaptations by modifying communications, adapting the environment, and providing information and materials in different formats. Ambassadors work with the Centre for Applied Autism Research to create their pledge and receive a certificate and continued support. At the last APG, several agencies expressed their interest in taking this forward locally, and it was the group's ambition that it could be adopted by client-facing teams in Baines. We haven't had conversations with those teams yet. We haven't taken it forward, but I would like your view on whether you would like us to pursue that. The newly recommissioned Autism Outreach Support Service, which I mentioned previously, it's just that contract was won by Fossway. and it provides training, advice and support to early years settings, schools, colleges and families. And this support is essential to ensure that children with autism are able to sustain their school placements and are supported to achieve and thrive. Another area of improvement that was brought to the Health and Wellbeing Board previously was that we needed to clarify the mental health pathways for autistic adults, and work is underway to improve access and pathways at the moment into mental health services. A joint working protocol for people with more complex needs, which cross professional boundaries, is in development locally in Baines, and this is involving key partners including Urgent Care, AWP, BAS, Housing Services, Bathmind, Drug and Alcohol Services, the police and commissioners. And the intention is to agree respective roles and the joint working arrangements for people with complex needs to ensure they're jointly supported. Okay, next slide, please. I think we're probably a bit behind. It's slide 10 that I'm hoping for. No, it's not that one. Back a bit, sorry. Back a bit. Right. Which one is slide 10? We've done the values and principles, so it's not that one. It's the Baines, Wiltshire, Swindon operating plan that we need. Thank you.
That's
Sorry about that. I've made reference already to BSW, and we're working out how our work at a locality level fits in with a larger BSW footprint. However, the BSW operating plan has 3 priorities already, which obviously fit with Baines. And one of these is transforming care for people with a learning disability and autism. The Baines, Swindon and Wiltshire All-Age Learning Disability and Autism Transformation Board is being established, and this is going to meet every 6 weeks. The purpose of this board will be to develop sustainable and effective system-wide service improvements and initiatives with a focus on transforming care for those with more complex needs and care needs identified in the NHS long-term plan. We're currently mapping and gapping local and BSW-wide pathways and services and completing local needs assessments. Priorities already identified across BSW include supporting primary care networks to improve and increase the uptake in annual health checks for people with an LSD or autism spectrum disorder, and a reduction in out-of-area placements, placement numbers by co-creating options for BSW provision of early intervention, prevention and crisis support services. So there's lots of work going on, and I will endeavour to keep you updated. The next 2 slides, I just thought I needed to give you a brief update on the needs profile and trends. So the growth in the numbers of children with autism has been the fastest growing area of primary need for children with education, health and care plans. Between January 2013 and January 2017, there was a 90% increase in the number of children and young people with a statement or an EHC plan maintained by Baines who have a primary need diagnosis of autism. And currently, around 1 in 4 of our children with an EHCP have a primary diagnosis of autism. 4 out of 5 of this cohort are male, although there's a growing body of academic research indicating that girls are not being identified early enough. There's also an increase in the number of children referred for autism assessment and diagnosis within the local authority, as evidenced by recent health data. So in July 2018, we had 294 young people had been referred in that school year, for a diagnosis of autism. And then the following year, September 2018 to July 2019, that number increased to 351. And locally, children in need are much more likely to be diagnosed with autism compared to national figures. Okay, next slide, please. Okay, so this slide is showing the BAMES LA maintained statemented cohort with the top five primary care needs, and you can see the one on the far left is showing the increase in numbers of young people with autism spectrum conditions. Okay, next slide, please. And this is just showing how the numbers to the Autism Outreach Support Service, which is the service that Fosway delivers, and they have won the contract from September as well. Just showing you how those numbers of referrals have increased over time. Okay, and the next slide, please. So at the same time as the needs data, at the same time, we've got some data relating to the increase of numbers of in BAMES of autistic adults. Modelling suggests that there are just over 1,600 people living in BAMES with an autistic spectrum condition, and we're expecting this figure to rise by 8% by 2030. Okay, next slide, please.
Becca, could I just indicate, if you like, we're a little bit time sensitive at the moment, because I want to get some time in for questions if I can.
Absolutely. So shall I whiz through now? So we've seen numbers increase slowly for adults as well, and we're currently the specialist commissioning team is undertaking a large strategic commissioning project focusing on community support to include supported living, respite and community outreach for those who have eligible needs. The next couple of slides, which I think are in your agenda pack, gives you a flavour of the services, the sort of length and breadth of services that we've got available for adults and children with autism. So I won't go into any detail there. Thank you, that's adults. And then the next slide is basically bringing us background to the autism strategy. And we've seen the visions and our vision, values and principles. And these are the priorities that have come out, they've been co-produced by the Autism Partnership Group. So priority 1 is all around joined up commissioning and delivery, so that we've got a better understanding of current and future needs across health, education, social services, and across children, young people and adult services. Next slide, priority 2. Concerns improving access to diagnostic and post-diagnostic support for all agencies, for all ages, making sure that we build on people's strengths. It does remain to be seen how we work in the new world with our virtual assessments and using the Attend Anywhere platform. And the next slide, priority 3. This is our priority, which is aimed at ensuring autistic people and their carers get the right support at the right time in all areas of life, including employment, learning, education, housing and life transitions. And the fact we've got such good multi-agency buy-in from our Autism Partnership Group means that we will be having a number of different work streams around these areas. And the next slide. So this priority cuts across the whole of BAMES and aims to increase awareness and understanding of autism across the whole community, so that autistic people are accepted, included, safe, and able to access services and opportunities within their own community. And I think this priority will help us deliver our overarching vision, if you think back to that, which was all about making sure that BAMES is an inclusive society for people who are living here and visiting here. And the final slide, I just wanted to give you a very quick update on how the fact that the timeline has shifted, has unfortunately slipped because of the pandemic work that we've all been involved in, but we are still planning to have completed the draft strategy by October 2020 to be able to sign it off by December 2020. And then we'll have a dynamic action plan that sits underneath that will be monitored by the Autism Partnership Group. Okay, thank you. Bit of a gallop at the end. Hopefully
that's lovely, Rebecca. I mean, and I think everybody will pick up there's been an enormous amount of work that's gone behind that. There's a lot of detail in there, and I think it's reassuring to know that we're actually in front of the curve in terms of the all age strategy element of it. Obviously, I'm going to open this up now for comments and questions. I've got nobody indicating on the chat at the moment, but I can see Kate's got a hand up.
Yep, shall I go, Rob?
Yeah,
Rebecca,
off you go.
Yeah, thanks, Rebecca. That was really detailed. Thank you for that. It's really just a query. I think you touched on some development work around flagging on health records for people with the ASD diagnosis. I think, did I hear you say 2023-24 for that?
That's the timescales that were previously published. Yeah.
Okay. So just thinking about the work that's been going on with Virgin Care and the ICR, is there no way of developing that? Joe might want to come in here actually.
Yes, I can answer. Sorry, sat next to Kate.
Sorry.
So Rebecca, I'll pick that with you outside because I think there's an easy way that we can flag now that the RUH, social care, liquid logic and community data is all linked up. We can add a flag to the record. I don't think that needs to wait. So I'll pick that up with you directly outside of this meeting.
Okay, great. Thank you, Joe.
And welcome to the meeting, Joe.
Hi, sorry. Yeah, I've been sat next to Kate. Sorry. Thank you, Rob.
That's okay.
I've also been, actually do have a question. Is that okay to ask?
Yeah.
So first of all, I was looking at, obviously, Rebecca, you came straight after the Children and Young People Subcommittee report. And what for me would be very helpful is I was thinking, how are they aligned? And the members of each board aren't on the papers. Now, I think it would be quite helpful on the papers to understand who's part of those groups, to understand if anybody's missing from them. So that was a short request. And linked to that, I think I would like to see the link between the two papers. So it was, of course, you know, the health focused lens, but also the link or reference to schools and the alignment with children's strategy work, plus also the support for parents. It's certainly something that we've seen coming through to the hub during COVID is the number of parents that are reaching out for support with their autistic children and being extremely concerned about being able to get them back into any kind of, you know, education or training as a result. So not just a COVID thing, but seeing the priorities clearly linked to the other pieces of strategic work, and then understanding who is on the other piece of strategic work, so we can start to make a link between the systems, and as a board we can understand how the pieces of work are joined together, if that makes sense.
Yeah, no, it makes absolute sense. Obviously it's an all-age strategy, and so it obviously does take in children and young people, and will, you know, be covered in that piece of transformation work that is currently taking place. So absolutely, we do need to join it up and make sure it's properly aligned. Just to say, I think one of the appendices did include a list of, well, it had the terms of reference, and that included the membership of the APJ. So I think you've got that in your papers somewhere.
Thank you.
And I'd just like to add as well, Joe, thanks for raising. I did notice, Rebecca, it was in the paper, so thank you. And the terms of reference for the Children and Young People Subcommittee have also previously been to this meeting, so they should be on the website, but I will make sure, if they're not, that they are on there.
Thank you. Kevin, Councillor Kevin Guy is indicated.
No, Rob, my comment was from before, so it's okay, thank you.
Oh, was it? Okay, that's fine. That's fine. I have a question, Rebecca, because of the impact that COVID's had on a lot of the practices and services that we give to obviously these guys. Is there an opportunity? And I understand that their challenges actually dictate a lot of it, but is there an opportunity for us to look at different and better ways of supporting them? Because I know where we're opening up facilities for people to go to those facilities, have we found maybe ways that are maybe a little bit more technology driven, but better. But I do understand the challenges.
Yeah, absolutely. I mean, the feedback that we've had from our providers is that some people have really appreciated the opportunity to be able to meet virtually rather than face to face, and so some people I would say have got on really well with that. And we've got a provider forum tomorrow, and one of the items on that agenda is to make sure that we capture the positive innovations that we've all been we've all had to put in place, because we don't want to lose that. So absolutely, we will be making sure that we don't lose some of that, as you say, sort of the technology based interventions that all our providers have been really flexible and really creative and have just sort of picked up and run with. So definitely that's going to be an added sort of string to our bow, I think.
Thank you. And I think Sarah's got a question.
Oh, yes, please. Thanks, Rob. Rebecca, thank you for that. It was a really interesting paper. There were two really quick things. One, just out for information, who's the representative for Bath Spa University? And also just to say, we've seen probably a 30% growth over the last 2 years in terms of students at Bath Spa University on the autism spectrum. We've got around 100 current students. A number of those are from within the Baines area, so haven't moved into the area. So it would be really constructive to sort of join in and contribute. And I think there's a lot of learning that we can both share and also contribute to taking this forward. So really keen to be involved in the partnership group.
Great. So I'll contact you about that. We have University of Bath are a member already, but we would love it if Bath Spa could get involved as well.
That'd be fantastic. Thanks, Rebecca.
Okay. I mean, I have another question, Rebecca. I mean, obviously, I don't obviously understand the workings of the appointments and the assessment process in depth. But anybody who was looking at this to see like maybe a 7 or 8 month time frame on that one, is that driven because you have to have that time frame to do assessments in there, or is that basically a resource matter?
I think it's partly to do. It's a multi-agency assessment, and so there are a lot of people. Typically, at least 2 people involved. It's paediatrician led in most cases, although for the more complex cases, then it may be CAMS led. I think it's got something to do with the capacity of the services. It is also to do with the fact that it's a complex piece of work to complete an autism diagnosis, and it does involve doing a lot of research into presentations of young people as small children, finding out a lot about what's been happening. So that it is an involved piece of work. But I do think it takes professionals, and we haven't got lots of those professionals. Only a couple of people in post. So
and that process is it reviewed in so much, because sometimes we do things because we've always done that and we've always involved certain people. But do we actually tailor the review to bring in those that we need to bring in, as opposed to including everybody, because that's the way we do it?
No, I believe so, but I also believe that there is quite a set, a prescribed way to do it. So within nice guidelines state how one should complete an autism assessment. So we are bound by those guidelines as well.
Okay, all right. Okay, thank you very much for that. I have nobody else on chat that's indicated. I can't see any hands waving or anything like that. So, well, what I would like to, first of all, we're invited to agree the recommendations, and again we will follow the previous procedure. if anybody is actually against the recommendations or abstains from the recommendations, can they please indicate on chat? And I'll ask you to do that now. And as at the moment, I can't see anybody that's on there. No, nobody. So the board has accepted those recommendations. Can I thank you, Rebecca? I do know that it's an incredibly complex piece of work that you've done, and you've pretty much brought this from nothing to where it is at the moment. So I know you put a lot of work into that, and you've done a lot of engagement. So, and I think as an authority, we should be very pleased with where we are in terms of being at the front of actually managing, the needs of a great cohort of people. To be honest, I mean, they really is they are a joy. So thank you very much for that. And I don't think I need to do anything else on that piece. So thank you very much for that.
Thank you, Rob. Thanks.
The next item on the agenda is over to David and Corinne and Louise. It's the COVID-19 update and position statement.
Okay, thank you, Chair. If I can kick off, and I'll then pass over to Corinne. My name's David Trithui. I'm the Director of Partnerships and Corporate Services at the Council. Attached to the agenda is a link to the paper that went to Council last week and previously to Cabinet and scrutiny panels around the position statement on COVID. So I'm not going to talk in detail about that because that's had a great deal now of public exposure and discussion. And in a minute, Corinne and her colleague will do a presentation on some of the issues in the health system. But I'm just going to make a few comments introductory. I think what the reports have shown is that we responded really quickly and effectively to the situation that we faced to protect public health and safety. Obviously, a lot of our services had to adapt hugely. Our staff had to adapt, our partners had to adapt. And again, I think there's evidence of real innovation and new solutions being worked on. And I think particularly there'll be some discussion later, I'm sure, around the Compassionate Communities Hub as a major success of our collaborative approach together. But also from the position of Council, you know, we had to respond by giving what is now £38 million of grants to businesses, and those businesses included, you know, a number of people working in this context. And now we're moving obviously now into sort of the reopening stages and the future renewal. But I guess obviously key issue for us again though is that all of this had a profound effect on our finances, and what you'll see is the recovery plan for that going to Cabinet on the 2nd of July. We've had to act very quickly. Effectively, we're losing £91,000 a day income from heritage and car parking. So every day we're not acting and responding, that additional loss and that total deficit at the moment totals up to £42 million. So clearly, as we go through and we put those recovery plans into place and start planning the future, that's going to have some big impacts in terms of how we operate in this agenda and in others. So, you know, I think there are just some summary points from me on that. And then I think I'll hand over to Corinne and a colleague who are going to do, I think, going to use some slides as well. And then maybe we'll have a discussion after that, Chair, around some of the...
Thank you, David. Corinne?
Yeah, thanks, David. And yes, I do have some slides, and I'm going to ask Susan just to see whether she can put them up on the screen and take us through those. But just to acknowledge, this isn't quite the same as being in a room together, so it does feel very two-way, and it's hard to kind of gauge reactions. So I'm sure if there are any questions, you'll pick those up at the end. So I'd like to introduce Louise Cadle as well, who's our emergency planning lead for Bain, Swindon and Wiltshire CCG, who is going to do the opening few slides, and then I'll come on to a few more at the end. We just wanted to run through what we've done in response as a CCG and also what we've done at a Bain's local level, just acknowledging David's comments there around the partnership working, the joint working, which has put us in a strong position in terms of managing and responding to the COVID pandemic. So I'll hand over to Louise, who's just going to run us through. If we can just go to the next slide, we'll just highlight what we're going to do. We're just going to cover the timeline, our revised incident coordination arrangements, our key priorities currently, and then the role and purpose of the BAMES locality and community hub going forward. And then we've just got a few slides with some infographics, which is probably quite useful for you all to see towards the end. But bearing in mind time, we'll probably whistle stop through some of the slides. Louise, over to you.
Okay, thank you very much. If we could go on to the next slide then, please. Okay, I just wanted to give you an overview of the timeline of where we are and what's actually happening. What I would say is it's a marathon, it's not a sprint. We're week 21 of a major incident response, so this is quite unprecedented, as you're obviously all aware. We've gone through what NHS England and NHS Improvement have dictated as a sort of timeline in terms of response to this pandemic. We are in sort of phase 2, which means we are still at NHS alert level of 4, which is a national major incident, despite governments downgrading the COVID alert from 4 to 3. Just reminded people that we are still at an alert level 4 for the NHS. We have seen a reduction in COVID admissions and deaths across BSW, which thankfully is very much welcome. We do, however, await further potential waves, particularly with the relaxation of some of the lockdown and, you know, as we go through the coming weeks to see where that takes us. We do also have still a number of patients who are actually being treated within our facilities, some with chronic pulmonary issues, some with diminished physical abilities, and clearly a community that is impacted in terms of being isolated and some of the impacts of COVID on them. So we just need to kind of hold that thought that whilst we you know, are still in response and things are progressing positively, we still need to just keep a bit of a watching brief. So if we could just go on to the next slide, I'll just summarise very quickly in terms of what we did. So in terms of setting up a command and coordination structure across BSW, we had our first meeting on the 31st of January. I think we'd really got to grips quite quickly that something wasn't going to go away. We set up a BSW health and social care strategic group and also a tactical group. These groups started initially meeting sort of daily and now have progressed to weekly. To support the work, we across the CCG set up a number of work streams. Clearly the locality hubs have been very key to that, so we've had one for each of the local authority areas, and key partners have all taken part in all of those meetings. We also across the CCG set up a number of work streams, some which were internal but also some which were external. So a really good example is the work that we've done across BSW, particularly in the mental health work stream, which clearly then supports some of the locality work. We've also been part of the Avon and Somerset Local Resilience Forum and also Wiltshire and Swindon. These forums are actually set up in response to major incidents and are based on a police force boundary. So from a CCG and a system perspective, we've been quite challenged where we sit in 2 police force areas. So, and I know certainly, you know, DPH will actually, you know, have some thoughts on that himself as well. If we could go to the next slide, please. So just wanted to touch on some of the key priorities that we've been working on, particularly as a CCG. So I think you've probably all seen the headline news around personal protective equipment, things like face masks, aprons and gowns and so on. We established a PPE work stream across health and social care fairly quickly. We really felt that there wasn't adequate supplies coming through our normal supply chains, and certainly some of the stuff that PPE that was being distributed through the normal NHS supply chains just wasn't enough. We have sort of gradually moved into what's called a push model for PPE. We've not been able across the NHS to order amounts of PPE in the volumes we would normally be able to. So a lot of it is just in time. So we do find many of our providers with less than 72 hours worth of stock. So as a CCG, what we started to do in the early days was we went out to across the communities inviting local businesses if they're able to produce or if they have any PPE that we could kind of buy off of them or purchase and so on going forward. So we've kind of set up a bit of a procurement strand, working very closely with not only health colleagues, but also supporting social care, as well, as we've kind of felt very much we are a system across health and social care. We've also had to rely heavily on mutual aid arrangements, and this has been quite challenging. As I said, it's just in time, so trying to courier items from hospitals to providers to primary care and also to care homes as well. We have set up a bit of a warehouse, which you can see pictures of. I can't tell you where that warehouse is. That's highly confidential, as I think some of the stock in there is probably of quite interest, and obviously certainly quite a lot of money that as a CCG we've had to invest to support our providers. And again, we've worked very closely with the local resilience forums who have had some PPE drops, the quantities of which have been very, I would say, insufficient to meet kind of the local demand of all of the organisations that access these stocks. And I would just add with the PPE, it's a continued watching brief, because obviously as we restart services, and as you all know, some of the changes in terms of relaxation of social distancing and wearing of face masks and things like that, some of this stock is quite, you know, the supply chain is quite fragile. Could we move to the next slide, please? So testing, this is currently what is in place. I would say it probably will change by the end of the day and by tomorrow and so on. It's been something that's really been hard to grip with. So I just wanted to cover a couple of the key areas. So clearly we have within the acutes, we are certainly testing patients that are coming in for urgent and planned care. For those that are coming in for elective surgery 14 days prior to their operation date, they are coming in for testing just to see whether or not they actually have COVID. And obviously we are testing some of our NHS staff. We have what's called Pillar 2, which is, all of you will have seen the news headlines, these sort of large regional testing units supported by some mobile testing units. We've got one at Bristol Airport, and one has been identified in Salisbury and at Swindon at 2 park and ride facilities. So those regional test units are there to support the Pillar 2 testing, which is there for anybody who has symptomatic they can go onto an online booking portal and request a COVID test, whether it be via the regional test units or some of the mobile testing sites that do move about to support any local areas or outbreaks, or equally they could get a sort of home test kit. We've been doing quite a lot of supporting adult social care in terms of care home testing, and certainly supported by the MOD, who have delivered a lot of the swab kits to all of the care homes. And GPs, we did a pilot earlier last month, which was testing 200 GPs across 20 practices, just to see whether or not they actually had COVID. All of the GPs were asymptomatic. So it was quite an interesting exercise, and thankfully all of the results came back negative. So that was part of a national pilot that was rolled out. At this stage we're not carrying on with that pilot, but you know, certainly I suspect that's something that we'll be asked to do again, and maybe in some other healthcare settings. Could I go on to next slide, please? So some of you have probably seen the news about antibody testing. We've got another pilot that's being rolled out for NHS staff and patients, and we are also going to include social care colleagues within this pilot. It's unclear at this stage whether it's going to be an ongoing sort of testing process. It's certainly at the moment a one-off. What the antibody test will do is actually just provide evidence of the prevalence of COVID. It's not going to inform us of anything else. There's no evidence at this stage to suggest that if you've had COVID, you will be immune to it. So we are really stressing for those staff that have asked to have this antibody test, that there isn't a relaxation. You know, they will still need to follow PPE and robust infection prevention and control measures. This will be offered across all of the NHS staff and also social care staff, and the intention is that we should have tested around 85% of those between now now and mid-July. So just to give you an indication in terms of the numbers, for NHS staff only across BSW, there's around 29,000 staff that will be offered that test. So this isn't a light, it's quite a challenge to deliver that volume of antibody testing. So given as well to include social care colleagues as well, it's quite an undertaking, but will really provide some strong evidence as to what the prevalence is across our area. So can I go to the next slide, please? And then just the last couple of slides before I hand to Corinne. A key piece of work for us has been about health and wellbeing, and I know certainly public health colleagues are very interested in this and working very closely with us across BSW in terms of the mental health work stream that's up and running, and also including colleagues from AWP, Oxford Health, and various other organisations. This piece of work is really looking at the consequences and impacts of COVID, particularly looking at the physical and psychological impacts it will have had both on our communities, but also on our staff as well. So we've also pulled together quite a good online directory of resources for mental health and wellbeing services, which we did launch during Mental Health Awareness Week. And it has got a really strong menu in terms of support from not only NHS organisations, but from private and the voluntary sector as well. There's also a really good bereavement menu which is out there both to support staff but also our communities as well, who will have certainly been impacted by this. And then my final slide, if that's okay. And certainly one of the key things that we're really looking at now, and we hope to have completed by the end of June, is a sort of wellbeing strand of that mental health work stream. And that's around continued advice and tips on coping, mental health, first aid training, both in the workplace and obviously some of the other community settings, and sort of peer support across the different networks. Suicide prevention training obviously is critical to some of this, and then finally really looking at the sort of enhanced psychological support offer that has been offered out nationally across NHS, but we're looking to roll that out across all health and social care as well, certainly across BSW. So those are a few slides from myself. I'm going to hand over to Corinne to kind of focus more locally on BAMES.
Okay, thanks, Louise, and thank you. So another key priority has obviously been our care homes, and certainly at a local level, we have focused a great deal of attention, quite rightly, to our care homes through the BAMES Community Response Hub, which Louise alluded to earlier in response to the pandemic. But across BSW, as you can see there, we have 287 homes and 58 are CQC registered in BAMES. We have a care home oversight group chaired by our Director of Nursing and Quality, which is really to consider what else further the health support needs could be of care homes. And that oversight group continues. But at a local level, you can see there are just some highlights of what we've been doing jointly, and that's across the CCG with the local authority, in terms of supporting the infection prevention and control. A great deal of work around that in terms of the framework that's been developed. We have repurposed and trained a team of IP&C officers who have come from different areas, either of the council, who've been repurposed and trained to support the PPE training in care homes. And we've also had webinars, as illustrated there, from Dorothy House Hospice around end-of-life care and supporting care homes. There's a great deal more information if you're interested to see what we've done to support care homes in response to the Ministry of Housing, Communities and Local Government that we had to respond to at the end of May. And that really gives you a lot more detail, but hopefully that gives you a sense of the priority that we have focused on our care homes, recognising the impact that care homes have had across not only locally, regionally and indeed nationally. Next slide, please. So moving into the restart, as we are in restart and recovery, just here to highlight our approach across BSW and the 3 areas of focus. I don't intend going through those in detail. I've got a few more slides just to go through. But essentially, we've developed a set of design criteria and principles by which we will continue to work as we reset and restart services. And as you can see, and I've alluded to already, a lot of work has already been done around being digitally enabled through COVID and allowing online consultations and remote working for a lot of practitioners. And again, Rebecca touched on that in terms of her update around ASD. So next slide, please. So the key areas of work remain around restarting referrals, so GPs and other practitioners being able to refer into appropriate services. We're been encouraging people to access healthcare services. I think we have all acknowledged through the pandemic, we saw people stop accessing services, either because they were worried about getting COVID if they attended, but also because a lot of people were either shielding and so forth. So a great deal of emphasis about if you've got an urgent need, seeking healthcare intervention. It's really important. Restart activity has also been about embedding those new approaches. So virtual outpatients, recognizing that as we live with COVID, we have to retain the social distancing measures. Of course, at the moment, that is currently at 2 meters, but that might change over the next 24, 48 hours, depending on what the government says. A lot of focus around communicating what services have restarted and how differently they will be delivered, and particularly the messages to patients and the public around that in terms of expectations of attending services and what that does mean. Another key element has been the continued work with the independent sector and the capacity that they have in support of our acute providers, and to ensure we're targeting the clinical need on waiting lists collectively, because obviously that's been a big impact in terms of the growing waiting lists as a result of lockdown. And then essentially managing patient transport for both COVID and non-COVID-19 patients. Patient transport is often one of those areas that is in the background, but obviously it's really important that we safely transfer patients as well. So next slide, please. The key challenges around the restart, and as Louise has already alluded to, the supply of PPE and drugs, particularly drugs associated with being able to do operations in hospital, and confidence in consumable supplies, particularly around intensive care equipment. Managing sites with COVID and non-COVID areas, maintaining that safe distancing measures, and that does mean that our hospitals and indeed our community hospitals have had to take capacity out in order to maintain those safe distancing measures. And we need to think about those measures as we go forward, not least with winter on the horizon and living with COVID. Household self-isolation and testing before treatment. We've just talked about in terms of people being needing to be tested before coming in for treatment. If they are tested and found to be COVID positive, then they obviously have to self-isolate before they can receive treatment. We know the waiting list has built up over the period that we've been in the pandemic, and we know that just working through it won't be enough, and we'll have to really think about what else we can do in order to bring waiting lists down. We know patients have been presenting later and are now needing greater intervention because of presenting later, that their needs have escalated and therefore need a greater level of clinical input, and particularly on discharge. I think we're seeing in community services, people coming into community services with greater needs. And as we've already alluded to, the impact on inequalities and not wanting the inequalities gap, particularly in BAMES, to be broadened as a result of the pandemic. But we really do need to understand what that impact has been. Next slide, please. So progress that's being made, we are developing a whole system service directory of service availability, because again, to keeping everybody informed of what's available. We have agreed a process for transport across the Southwest as we work with our patient transport service providers. We are making good progress on increasing virtual outpatients and advice and guidance, particularly for our primary care clinicians, linking with secondary care. Primary, community and secondary care clinicians really working together on new service delivery models, and some of that we've seen in the pandemic, we, in terms of response of new ways of working, we've continued and looking at as we go forward. We are considering moving to either a single waiting list across BAME, Swindon and Wiltshire, or at least at locality level, as we continue to work across the acute and independent sector to utilise capacity. And then really thinking about community alternatives to acute care and what we can do in the community to support people at home as much as possible. Next slide, please. So I'm going to go to this. It's just an illustration of the BAME's locality hub and the ways of working. You can't see all the detail, but it was really just to show that we are still in COVID response. And if we go to the next slide, and then I should just wrap up. The role and purpose of the community hub really going forward is twofold. We need to remain prepared for COVID and ensure that we can restart and restore services in a safe way. And our key priorities as part of that is around supporting the control and management of outbreaks. And I know we'll come on to Bruce's outbreak plan shortly. Maintain the patient flow out of hospital settings and supporting people as much as possible in the community, recognising we do have winter and seasonal flu. Ensure services are able to restart in a safe way, and also continue to take forward service transformation at a local level in line with the BSW long-term plan priorities. And what does that mean for us at a local level as we take those forward? And then just finally, a few infographics. So we just thought it was helpful just to give you a sense of what's happened across BAME, Swindon and Wiltshire. I'm not going to read these out. You can see this for yourself, but it just gives you a sense of the sheer activity that has happened and continues to happen. So if we go to the next slide. So this just gives you a sense of the volume of PPE items that were donated across BSW since the appeal. 20,000 video appointments by GPs in the pandemic. As many of you know, we had a Nightingale Hospital opened in Bristol to support in the event of the surge that we were expecting. And then the final slide. And there, again, in response to managing patients safely, the hubs that were set up in primary care and GP surgeries to manage patients who were presenting with symptoms, 10 of those across BSW at the height. That's scaling back now. And then we did a lot around keeping our GPs informed through webinars on a weekly basis, which again have continued, but are being scaled back. And then really important is the work that's happened through the Compassionate Community Hub in BAMES. Equally, they've been called something different in Swindon and Wiltshire, but how volunteers have supported people in the community, which has been extremely important. And I think the BAMES success has been the Compassionate Community Hub, which has really brought together the third sector with the statutory sectors to support people in BAMES. So I'll finish there.
Thank you very much. That's a very in-depth and whistle-stop tour through all the work that's been done. I mean, huge amount of work going on and things like that. I'm sure there's a few questions that will come out there. I'm just conscious of the time. We're running about 6 minutes behind at the moment. So I'm not going to curb any questions, but I'm just making sure everybody's aware that we want to try and keep them succinct. Have I got any questions? Nobody's indicated a question at the moment. I can't see any hands up. I've got a couple of questions that I'll fire in while we're thinking, or people are thinking. Around PPE, I mean, there's obviously this inevitable question about any spikes that might appear. If we are working on a just-in-time process, which is great when we know what the demand will be, but if we get an anticipated spike, what provisions are being made to accommodate that? And my other point will be, and then I'm going to bring Will in after we get the answers. We actually do have a mobile testing unit, an MTU, currently based now at Odd Down. That's just appeared. I think our public health team have been really, really good, because at one point I think we'd lost it, and then through negotiations we've got it down to Odd Down Park and Ride, and it's been quite well used, I can understand. So well done to that team for doing that. about the PPEs. Anybody got an answer on that?
So if I may, Councillor, in terms of PPE, we've got a really good mutual aid arrangement in place. Certainly looking to utilise any avenues of PPE. We are cited as a CCG in terms of what is within each of the NHS organisations. So if we had a need or an outbreak in a particular area, we could certainly pull resources as we can. And then again, we've also got those links across the entire Southwest if we needed. In terms of the just in time, that's not something that we actually would want. It's something that has unfortunately been enforced because of the national supply disruptions that have occurred, but the disruptions are getting better. It's not quite as bad as it has been in the past, but we certainly, you know, are cited on daily situation reports from all of health and social care providers. So at this stage, we don't anticipate it to be a problem.
Okay, thank you very much. Will, I understand you want to come in?
Yeah, thanks, Rob. Look, you know, really helpful presentation. It's really interesting to see that data. Just, I think, two things to me. It would be interesting as well to just have the numbers of how many people were discharged from hospital into care homes in that period from I guess the beginning of April, just to get a sense of what that number was. And I think the other thing for me is, and this sort of links a Bitcoin into the next item. The bit that does worry me a little bit is that how we're balancing the regional system structure with the very local need for the focus in terms of outbreaks. And I think that's, you know, so a lot of that information is at a BSW at a level, and the analysis is at that level, and that's fine. But obviously, when we get onto things like the outbreak management plan, that's specifically at a BAMES level. And the thing that makes me a little bit nervous is, you know, you go through a process essentially to suck things up to a regional level. Just maybe we can just have a bit of reassurance that within that system, there is still a very strong focus on each locality, because that's a bit that worries me a little bit.
So thanks, Will. In terms of the numbers, I can't give you the numbers, and I'd have to come back to you on that in terms of people discharged from care homes, from hospital. In terms of your other point, I think, you know, the locality focus, and as I said towards the end there, around supporting and involved in local outbreaks is really important. And I think obviously Bruce will come on to that. I mean, I am now sitting on the health protection board for COVID-19 and the subgroups. We are making sure that we're locally linked in as well. So I think that focus on locality remains really important. I know that's the case in Swindon and Wiltshire as well. So to be assured, very much still focused around that locality piece.
Okay, thank you very much for that. Just while I'm waiting for anybody else who wants to come in, I've got a couple of questions that I really want to throw in there. One is about the testing kits that go out for home testing, everything like this. We obviously hear about the numbers that go out for home testing. Do we have a measure of those that come back? Are they recorded out and then recorded in? So do we know what sort of percentage are actually coming back in? I would expect them to be high, but who knows? Maybe that's a question you can't answer at the moment, but maybe it will be something that we can have coming back at another time. The other 2 points I would really wanted to highlight is that within the presentation, there was mention about suicide and things like that. No mention on support on domestic abuse and recognition of that latency of that element that's going to appear or may still be there and being submerged by the isolation element of things. So I will be concerned about that. And then the only other thing is the comment you mentioned about obviously all the support about the care homes and bringing stability to the care homes, because I mean it was perceived as a neglected area in some ways and left out there, and I think you put a lot of work in to underpin that support, but also like to recognise that's been done obviously as a collaboration, because I know the council officers have worked incredibly hard as well to try and support that piece of work as well. So it's obviously a very good cross-piece work.
Thanks, Rob.
Well, if anybody wants to throw anything back other than that, I mean,
I think just coming back to your point around domestic abuse and so forth, I think that is something we're really mindful of in terms of the pandemic, and indeed acknowledging that we could see or have seen an increase, but I'm not necessarily the most qualified to specifically ask that. Colleagues may want to come in there, but that's something we're very, very mindful of. In terms of testing and percentage return rate, again, don't have the specific figures on that. We would have to come back to you. And you're absolutely right, the support to care homes was absolutely joint and multi-professional and multi-agency. And I think the joint work between via the Community Response Hub with public health, primary care, community services, etc., supporting the care homes was really testament to the partnership and joint working.
Okay, lovely. I think Les wants to come in.
Yeah, thank you, Rob. And just to pick up on that point that Corinne and yourself have referenced about domestic abuse, certainly we are looking at that across. We are looking at that through the Community Safety and Safeguarding Partnership, and we are also looking across that both at a Southwest level and at a national level through the safeguarding routes, because it is coming in there, and some areas are seeing a significant rise starting to take hold. We're not necessarily seeing that locally here, but we just want to clarify those figures.
Stage, we're asked to note the present. Oh, hang on a minute. Have I got any more in there? Sorry, yes, Bryn. Sorry, I missed you, Bryn. Sorry.
Yeah, no trouble. I was just trying to clarify that point about domestic abuse and safeguard and what's been done about it. Obviously, clinically on the front line, it's big concern around picking up safeguarding issues and all types of abuse when this started, because it's done by the more tacit consultations skills, which you lose in the virtual setting. So just as some reassurance to mitigate that across BSW and the health and care sector, there's some guidance that has a wide variety of involvement and input into that's being launched and hopefully operationalised very soon. And I think we're ahead of other local areas in that. So that's some reassurance that that work is taking place.
Sorry, so it's Leslie here, Bryn. Can you share that though with, I know it'll be shared across BSW, but I'll need to share that with the Community Safety and Safeguarding Partnership, because I appreciate that will be from a health perspective, and it'll be useful though for all partners to see how that interfaces with the policies and procedures we've got. So it'd be helpful to see. Thank you.
Right, sorry about that. Someone decided to start mowing the lawn. What a bad example for us all, isn't it? Yeah. Okay. I think we're asked to note the presentation, and thank you very much for it. It's a lot of information. It just shows how much work is actually going on behind the scenes, and it's very reassuring how we can adapt to these challenges. So I will do this by a show of hands. I don't think we have to have a formal vote. It's just noting it. So those that are accepting the report, please just indicate with a show of hands. Okay, yep, that's covered, that's carried, thank you very much. Right, okay, we're now 12:10, so we're running a little bit late. So I'm going to invite Bruce to present the local outbreak management plan. You know, sometimes we have acronyms that just make you smile, and this is one of them, I think, the LOMP.
Okay, can I have I've got a short presentation, you'll be pleased to know. Can I have that, the front of that? Thank you, just leave the front. Right, what's happened? I can't see it. I've lost it.
I've got it on mine.
Oh, okay. I've got that. Okay, so I'm going to talk fairly briefly about this because it's a late paper. We've had to produce it and get it ratified in a big hurry. So when just to set the scene, when we think about COVID, it's been incredibly momentous, and we will certainly remember the burden placed on care homes and older people who have suffered the bulk of the severe illness and death. We'll also, certainly in the council, be very mindful of the enormous impact on children who've in many ways suffered greatly. And of course, the children who come from disadvantaged backgrounds will have suffered the most through lack of education and being at home in difficult circumstances, and perhaps even in danger. And then the third slide is go back to the cover sheet. The third slide in the right-hand corner, I just pick a specimen. It's the drop in air traffic at the main British airports. And if you'd looked at that slide a year ago, you would have said, well, there must be a nuclear war or something. It has had such a profound impact that none of us could have really imagined on all of our society and way of living and economy. We go to the next slide. Whenever I think of an emergency plan, I obviously think of Helmut von Moltke the Elder, the founder of the modern Prussian General Staff, because he was a great tactician and strategist, but he said no plan survives contact with the enemy. And I think from what Louise and Corinne said, you can see that we can plan, and we can plan for COVID, but it's going to take us by surprise. It's a new disease. We don't understand it yet. There's lots we don't understand about it. So we're going to have to be very fast on our feet. So we have produced plans, but they won't survive contact with COVID. They'll have to be adapted. And so for me, I paraphrase that as it's the planning, not the plan. And what we have in Baines and in the region and in BSW is very strong history of planning, joint working, knowing who our counterparts are in different agencies, and getting on with the job in hand effectively and in good partnership. And that's something that makes us strong. The council obviously has a huge role in COVID in terms of adult care, children's services, the place in general, businesses and so on. But actually the council's role as a place leader was recognised rather late in my view. And it was really about a month ago that we were actually asked to put together these local outbreak management plans, I think after some recognition at the centre and lobbying from the LGA and the Association of Directors of Public Health. So this is a very rapid plan. It's been put together very fast. So as I say, it's not comprehensive, it's comprehensive, and it's work in progress. We can have the next slide, please. Just to set the scene a little, the top right, sorry, my thing's in the way. We've had 330 confirmed cases and 89 deaths in Baines, of which 50 have been in care homes. That gives you a sense of the absolute scale of what we've dealt with. That puts us in the 7th lowest rate so far in England out of 150 local authorities. And of the top 10, I think 8 or possibly 7 are in the southwest. So something about our population, something about our geography, something about our wealth probably means that the southwest has had a relatively light experience, which is obviously very, very good in one way. In another way, it means we have an even less immune population than the rest of the country. And if we try to think how many cases might we really have had, how many people might really have been infected, very, very difficult to tell. But if you imagine a small number of thousands, probably at maximum of 5% of the population in Baines in the southwest, maybe as little as even fewer than that. So that does mean that at least 95% of us are COVID virgin waiting to be infected. That's even if infection gives immunity, and we don't know if it does yet. If we look at the top right graph, that shows the course of the epidemic here, and you can see it was fairly light, even if we just take away the spikes, and if we look at the smooth orange line, we never really had more than 10 confirmed cases a day, even at the peak. If we look at the bottom right graph, that gives you the sort of proportionality of what this has really meant in terms of deaths compared to normal deaths. And the orange line shows that we have about 25 deaths a week in Baines. We don't have a huge community. And then the everything above the orange line gives you a suggestion of the immediate, either direct or indirect deaths due to COVID. So you can see for a few weeks it was quite a big increase, and otherwise it's been a fairly small increase. So that just gives you a sense of where we are now. Remember, of course, we locked down quite, well, some people say quite late, but we locked down towards the beginning of that graph. So that was by no means the natural curve that would have happened if we had not, but it gives you an idea of where we are. And then I think the graph on the bottom left is an important one too. That's deaths from all deaths in the grey bar and from COVID in the blue bar by deprivation quintile. And it shows you that far from all being in this together, people who are poorer and more deprived, every stage of this are more likely to suffer. They're more likely to get the illness because of the cramped living conditions, having to work in jobs where they can't easily do from home. They're more likely to then get ill and die from COVID because of many reasons probably, but prominently they have other illnesses, other concurrent illnesses that make them much more likely to die. So somebody said we're in the same storm, but we're by no means in the same boat. And I think that's important to remember as we decide how we deal with it in our community. Next slide, please. So the local outbreak management plan is about the future. We have no certainty about the future of the outbreak. I think that the more people know, the less certainty they have. We don't understand the behavior of the virus. We haven't seen it even through 1 year yet, let alone several years or centuries, as we know about other diseases. And we don't really know what's going to happen in the winter. It's quite likely that many viruses, not all, but many, get worse in the winter. So we have to wait and see. We don't know about immunity. We're testing everyone's antibodies to see who's had this, but we really have little idea yet, although we'll gradually get that as we pick up more antibody tests and see what happens to people who are positive and negative. But at the moment we have little idea. It would be fair to expect some level of immunity, but whether that's short or long lasting, and whether that's very deep and you simply can't get COVID twice, or whether you might get it a little bit more mildly, we don't know that yet. We don't know how policy is going to change. That's a political decisions based on both the epidemiology and the economy and the social issues. And of course, we don't know how people will behave, both individually and collectively. We don't know how our systems will work. They're being set up at the moment. And one example of that is that we were promised that the app would be like the foundation of the COVID system. And well, we haven't seen that yet. And to me, it's questionable whether we ever will. But the test and treat systems, they're cranking up. They're as good as they are, but they're not perfect and they're not comprehensive yet. And we don't know if we'll find better treatments. We've had some good promising treatments of severely ill people with steroids, so we're getting somewhere, but that's early stages. And then we don't know when and if we'll have a vaccine, and if we do, how effective it is. So there's lots of uncertainty. But for me, everything about the success in the future depends on probably two things that are within our control, lots of things that aren't, and that's how people behave. And that's influenced by policies, of course, strongly influenced, but it's not just influenced by policies, it's also influenced by how we view this as individuals and as a society, and whether we take care more or less. And then how we can respond to outbreaks, and the local outbreak management plan is clearly about that. And we've had some discussion of that already. So those for me are the two pillars of success, as I call them. Next slide, please. Just another perspective slide, which I think is interesting. I just won't go through the slide in detail, but just to say that what that shows, that now an average of 1 in 1,700 people in England probably has COVID, with a confidence interval that you can see, but it's actually quite a narrow confidence interval. So we can imagine that about 1 in 1,700 people currently have COVID. And in BANES, if we think that we've had half the experience of the English average throughout, then that means that maybe 1 in every few thousand does. So it might be that we have, as few as 50, maybe 100, maybe a couple of hundred people in Bath and North East Somerset at a maximum who at this moment have the virus. which means two things really. It means that we have the virus in Baines for sure, but it also means that if we're careful, I think if people are careful, behave well, if we can get on top of outbreaks quickly, we've got a good chance of getting through this reasonably well. I can't say what that chance is, but it's interesting to note that it's tens or at the very most a couple of hundred people. It's not tens of thousands in Baines who are walking around with this now. Of course, that must not make us complacent. Next slide, please. So the local outbreak management plan, as I said, it is a framework plan. It's built on certain principles. Strong principle first is to build on existing plans and networks. We've been dealing with outbreaks forever in the health service and in the public health service. We know what to do. We have good plans. We have good ways of working. COVID brings some challenges, but the basic principles of outbreak management remain the same. Find people, isolate them, identify them, isolate them. And we have a very good Public Health England regional team helping us with that, who are very expert in this, and the Southwest team, I think, are very strong. We're focusing national and local efforts. I think this is where the relatively late recognition of the sort of local leadership role has come in, because a lot of the programs are essentially led nationally or regionally, and we have a role locally in focusing those efforts, using our local knowledge and networks, using rapid data. Speed of response is essential. We've seen how quickly at the beginning of the outbreak and the pandemic, how quickly this can spread. We really need to get on top of it. And we really need to be aware where there are vulnerable communities where it could take hold rapidly without us being able to respond quickly. And we saw the first example of that in the care homes. We need clear lines of governance. We want our policies to be based on evidence. We want our responses to be based on evidence, on numbers and local intelligence. And it's very much a partnership response. There's the strong local role, but there's the Public Health England, the NHS, two LRFs really. For Baines particularly, we're in the Avon and Somerset LRF, but we also have to refer across eastwards, of course, and then regional partnerships. Next slide, please. There are 7 themes we're asked to deal with 7 themes in the plan, and you all have the plan, so I'm going to not read through the plan, but I'll mention the themes. So the first is responding to outbreaks in the highest risk settings, and care homes and schools have been strongly identified, and I think our plan is probably most developed, and big thank you to the testing team and Becky Reynolds. I think our probably the most developed bit is how we respond to those. So I like to think that between us and the NHS and PHE, we are pretty, in a fairly good position to respond up to a certain level of scale. Identifying high risk groups and settings, of which there are many. You can be high risk for medical reasons, you can be high risk for social reasons, you can be high risk because you're in a particular setting, maybe a homeless shelter, where it's harder to control. The next 2 themes are understanding and coordinating of the testing and tracing system. Again, we don't control all of that necessarily, but we are in a position to try to gather the information to find out how it's working and to target it quickly where it needs to be targeted, both the testing and the tracing. And some of the questions that people had before, how's all this working? I'd say to get the information from these systems has been a long and slow slog, and we are gradually getting the information which will give us that local control that we need. It really has been difficult, but we're getting there now. Protecting and supporting vulnerable residents, the great job that the Community Hub has done has been noted already in this meeting, and it has done a fantastic job. Some of that needs to continue. We need to be able to look after those who are in isolation, who are less able to look after themselves. This plan is particularly around those people in isolation. Obviously, there are many other people in the community who will require support too. Data integration is important. We're getting now, from getting nearly no information, we're getting bombarded with different bits of information of different quality from different agencies, telling us lots of things, and our task is to really make sense of it. And I try to do that by saying, everything answers some basic questions like, how are we doing with the outbreak generally? How do we know our systems are working well, our tracing and testing systems? And how do we instantly react if we get any sign how do we know quickly enough if we get an outbreak? So I think we need to put together lots of information to answer questions like that. And then finally, governance and the role of stakeholder engagement board. And I think stakeholder engagement is incredibly important. And I think this is where all partners around this health and wellbeing board and the council very strongly, but all partners have a real role, because as I said at the beginning, one of the pillars of success is how can we influence people's behaviours. We are reducing, we're loosening rules now. Every new rule, every loosening of a rule brings a certain level of risk. The virus doesn't change its behaviour because the rules change. The virus is there to spread at every opportunity as fast as it can. So we need to explain to ourselves and our workforces and the public, as far as we have the influence to, the more you distance, the more you take rules seriously, whether you're a business owner or a member of the public, the better chance we'll have of getting through this without having multiple waves, multiple lockdowns, and many more deaths. Next slide, I think it's probably my last. So the ask of the board is to endorse the plan, to say that, you know, we basically support the aims of this plan, so that we can put it out there as I call it always a working draft, really. You know, this will evolve and evolve, and work in partnership to control COVID. Each of you has a specific role. Everyone around the table is part of some agency or group that has their own role in this process, and you'll know what they are. But in general, as I've said, all our role is to open up services, businesses and lives while minimising risk, to take particular attention to workplace safety. We, between us, represent workforces of many, many thousands, and our workers, of course, some of us very strongly in the front line, some less in the front line, but all in some ways at risk, and all need to be looked after. And then the messaging we all give out. You know, already I think you're seeing on television, you're seeing how fragile it is, people's willingness to distance, to take this seriously, whether, you know, well, I won't talk about specific examples, but you can already see how fragile that public will is. So it's everyone's role to say this is serious, this hasn't gone anywhere, at least until we get an effective vaccine. So that's all I wanted to say, really. You can read the plan and you can ask questions, many of which won't have immediate answers, but that's my presentation on the plan.
Okay, I've got an indication from Will. He wishes to say something.
Yeah, thanks, Rob. So I guess first of all to thank Bruce and his colleagues for putting it together. You know, it's a really sort of good document, and we've had it checked out as well by the government regional lead for the Southwest, who's coordinating the stuff, and she's given some very positive feedback on it as well, which is really helpful. I think the bit that sort of testing my brain most, and I guess there's two streams to this. One is the messaging piece, which I think, you know, as Bruce said, is now becoming really complex. And there seems to be this narrative growing about it's safe outside and not safe inside. And I think that's, you know, and I'm sure there's a bit of science behind that in terms of, as it's hotter, maybe the virus doesn't spread as much outside, and I'm sure that's true. But I think there's also real danger with that message about being safe outside and unsafe inside, about, you know, as we go into the next few weeks, because I think that is going to breed quite a significant element of sort of complacency. And I just think that will complicate our messaging perhaps even further. And it's just something that, you know, it's really struck me the last couple of days, how that narrative seems to be strengthening. And I think we've got to be quite careful about how we put our own messages out there. So, you know, it's a really good starting point. It's obviously going through Cabinet next week as well. But, you know, yeah, it's a good position. And obviously, you know, it's great that we haven't had a great deal of cases, but as Bruce said, we need to be very alert to what's happening over the next few months.
Thank you, Will. I've got Kate indicated and then Bernie.
Yeah, thanks, Rob. And Bruce, that was really helpful. I guess I don't want us to lose sight of the longer term consequences of this and the work that we're doing, for example, in the hub, really picking up what this could look like for people and what it means for people long term. So there's something about how we develop sort of post this, really, how we develop that work and those services. So we're really responding to a very different concern, I think, that we're going to have autumn winter time.
Yep. Agree.
Yeah, it's just flagging it.
Okay, Bernie.
Thanks. Yeah, Bruce, that was very helpful. I'll share that within the university, within our health and safety, if you haven't already. But the point I wanted to make was something we've already exchanged emails about, and that was about the possibility of trying to arrange in some way for the mobile testing unit to be here when all the students come back to the two universities, because it won't be possible for them to drive out to Bristol Airport or to drive out to Swindon, because a lot of them don't have cars, but any of the ones who are on campus are not allowed cars. So some sort of facility for that might help us manage, as you point out, the increased risk. I know that some of it will be almost cosmetic, but it would certainly help us. So I don't know whether there's much you can do or much we can support you in doing to do that.
We can look at it. It makes some sense. We don't have unlimited control over the mobile units, but we will look at it, and Becky will take that forward, Bernie.
Brilliant. Thanks, Bruce.
Right, I'm not picking up on any other contributions or anything like that. I think without doubt we recognise this is a really complex document that's been pulled together in a very short period of time, and so I think Bruce and his team have got to be commended for that work. I think we've got 5 recommendations that we're asked to agree to. Everybody should have those in front of them, but it's basically to endorse the plan as a framework for BANES, support its further work, obviously endorse the roles of the health protection and local outbreak engagement boards. Members agree to use their influence to further the aims of the plan with different organisations, so obviously we cascade that out, and to support its general use of appropriate resources to enable the effective implementation of the plan. But that obviously that's not committing anything. It's just obviously it's aspirational in that sense. Now I think we can take those recommendations on block. I'll ask in the normal way that those that do not agree or wish to abstain, can you indicate please on chat? And then and if that happens, I'll ask that happen now. I'm looking at that and there's nothing coming through on that. So I'll just give it another second in case anybody's tapping away. No, okay, so that's unanimous with that. We're actually agree the recommendations laid out in the LOMP. Okay, thank you very much, Bruce. But you don't get away from it because I think you're on again. It's now the annual report of from the public health.
Okay.
Over to you, Bruce. Thank you.
We seem to have more or less run out of time, Councillor. I'm happy to, I could have spoken to this. It's an easy read. It looks like both a historic document and one I would like to say is absolutely dead relevant as ever, even more so post-COVID than last year. So shall I just say put it in as something for people to read? If they have questions, let them get back to me rather than talking through it, because there's not really, you've had a lot of presentations and I think we're pretty well run out of time for the meeting, unless people want me to discuss anything particular in it. Is that reasonable?
I think that's quite perceptive and quite kind. Thank you, Bruce. I mean, in doing that, it doesn't lessen the quality of the report. I mean, it covers a lot. I don't know if there's any pressing questions that you want to air here, or if there's something that you can go back to Bruce at another time, and if relevant, we can always bring that to the next meeting. Nobody's coming to me indicating that they wish to do anything. I'll just check the visuals. No. Okay, so on the basis of that, I'll ask that we endorse the annual report. Again, those indicating that they don't wish to endorse it or wish to abstain, please indicate on chat. And I'm seeing nothing. So that's unanimous. We are endorsing the annual report. So thank you very much, Bruce, for that.
Please, people do come back to me if there's anything you wish to discuss. It's a wide ranging and it is an interesting report. And you know, maybe another time we would have had a good talk about it. But so do come back if there's anything you want.
Okay, so everybody's picked that up. Thank you very much. Only leaves now to the next meeting. I don't know if Bryn, is there anything that you want to put in before we get to the end?
No, thank you, Rob. Just learning from you and looking forward to taking more prominent part in the next meeting.
Yeah, well, obviously you can see lots of areas of improvement, so well done. Yeah, okay, the next meeting is scheduled to take place on Tuesday the 29th of September. Is it 29th? Yeah. We don't know where we'll be. We don't know whether we'll be Zooming or whether we'll be in an aircraft hangar somewhere with distancing. So, but no doubt we'll all look forward to meeting up again. We'll all see each other in various other forums and pieces of work. So thank you very much for your attention today, and have the rest of the day to yourselves if you can. I'm going to go and now pick up the grass cuttings. Thank you very much. Bye-bye.